I'm gonna wash my hand. Hi, my name is Nurse Regine. Can you tell me your name?
Benedict Joaquin Milan.
What's your birthday?
January 25th, 2007.
How old are you right now?
12.
12? Okay. Do you know the reason for the visit?
Checkup.
General checkup, okay. So for the checkup, there's no any risk for this. Benefits is we're just gonna check to see if your age is appropriate. It's developmentally appropriate for your age. Okay. Do you prefer any language other than English?
Just English.
Just English, okay. Do you have any history that you know of, like health history? No. Okay. So I also double checked the history earlier from the chart. There's no significant medical history that I found. And just to confirm that you're here for the general assessment, right? Just the physical assessment. Have you been sick recently?
No.
Right. And do you have any, what's your diet like? Your breakfast, your lunch, your dinner?
Veggies and fruit.
Veggies and fruits. Oh, awesome. Okay. Do you have any active exercise that you do?
I go treadmill 30 minutes a day.
30 minutes a day treadmill. Do you have any active program or sports that you play at school?
I do PE with my PE teacher, Miss Guyon, and I normally walk every day. Every time I have PE classes.
You do treadmill 30 minutes, you walked for PE. Okay, that's pretty good. And do you drink any fluid
Water.
regularly, water? And do you go urinate, like pee regularly every day?
Yeah.
And how about poo?
Yeah.
Regularly. Awesome. All right. And do you think you're pretty much healthy?
Yeah.
Okay. Do you have any allergy to any latex?
No.
No. All right. Are you okay with if your mom is present here, or you want your mom to step out?
I'm okay with my mom being present.
Okay, mommy, do you want to be here, or you wanna go?
Yeah, it's okay. I can stay inside.
Okay. Awesome. All right. So I checked his height earlier. He is in the 90th percentile on the growth chart. His height is 63 inches. Weight is 110 pounds. And I checked the growth chart, and he's within the growth chart. All right. So I'm gonna do hand hygiene one more time. So one more time, I'm gonna just explain what we're going to do. I'm just gonna do a general assessment. I'm just basically gonna check from head to toe to see if you're developmentally appropriate for your age. Okay. And you're okay with that? Just checking, no invasive procedures, no injections or anything. Okay. All right. So it seems like, sorry, what's your name again?
Benedict.
Benedict. So Benedict, his verbal behaviors are pretty much appropriate. Do you have any pain right now?
No.
No pain. All right. He is male, Filipino, and he is 12 years old. All right. So earlier I checked his vital signs. I checked his temperature. He's within the normal range of 37.3 Celsius. I checked. There's three kinds that you can check: rectally, orally, or using the ear thermometer. And I did the oral temperature because it's not contraindicated for him. And also check the heart rate. I got 75 beats per minute. That's also within the normal range. The systolic, the SBP is 112. That's also within the normal range for him, for his age. And the respiration rate is 16 breaths per minute, and also within the normal range for his age. the respiration, I listen. I'm going to I listen to his lungs for at least a minute. I took the blood pressure, but I made sure that I had the right cuff. For the bladder cuff, for the width, at least 40% of the circumference of the arm. And for the bladder cuff length, I checked if it covers 80% to 100% of the arm circumference. And if I didn't find a bigger size, a fit size for his age, I can use the bigger size to get the blood pressure. All right, and all the vital signs that I took, it's developmentally appropriate for his age. For his speech, he can he can respond to my questions, and he understands what I'm saying, so his speech is pretty much developmentally appropriate. No slurring. So can you tell me where you're at right now?
Hospital.
You know the time, daytime, nighttime.
Yeah.
Daytime or nighttime?
Day.
Okay. All right. So, the Benedict, he is oriented. He can tell me the person, place, and time, and his behavior is basically appropriate. His behaviors appear to be appropriate for his developmental level. But if you see any changes to his behavior, Mom, you could always let us know so we can recheck him. Okay? So he's sitting, his posture, his shoulder is pretty much aligned with his hips. When he stand, I saw him standing and walk here earlier, and his posture is also aligned. Body movements when he was walking, it's pretty much symmetrical and purposeful. Looking at him right now, no tremors, no tremors in the extremities. Movements are pretty much coordinated when I was monitoring him walking around earlier. Is it okay if I check your head? Okay. I'm just gonna check his hair. Alright. Hairs are, it's kind of thick, but they're pretty much, no balding, no thinning of the hair. They're equally distributed. No lesion, no ticks, no fleas, no lesions in the scalp. And can you see your fingers? Fingers are cleaned. It's well groomed, and he looks pretty much clean and well groomed. And I'm not smelling any foul odor. So that's pretty good. Is it okay if I could see your feet?
Yeah, sure.
Feet are cleaned. No. Nails are pretty clean as well. Yeah, no any fungus or anything. Alright. So hygiene wise, Benedict is pretty much clean, well groomed, no odor, no foul odor, hair, no balding, no thinning of the hair, no lesions in the scalp, and no ticks, no any kind of abnormalities on the hygiene wise. Can I see your teeth? Just say out to me. So just looking. Teeth are pretty much intact. Missing one teeth. No cavities. mucosa, pink, hard palates, both palates are intact, no cavities. And one more time, just say ah to me. Ah. Uvula is present, pink. Okay. And I'm just gonna, is it okay if you could take out your glasses for me? So I'm just gonna put my light on your eyes. Just gonna be bright a little bit, okay? Alright. And just follow the pen. Alright. So pearl is present. Pupils are equally round, reactive to light and accommodation. And looking at the conjunctiva in the eye, no tearing, no exudate, no redness and swelling. Movements of the eyes are symmetrical, equal movements on both eyes. Condition of conjunctiva, no tearing. Yeah, it's pretty intact. So right now, I'm not gonna check the vision, Benedict's vision at this moment, but make sure to see a doctor, the eye doctor soon, okay? Alright. So both eyes, there's no briskness and equality of the reflex in both eyes when I did the pupil check. So I'm just gonna snap my left hand. Just let me know if you can hear it, okay? How about the right? Can you hear that? So I checked the hearing. He could hear me on both ears equally. No hearing aid present. And looking at his facial feature, nose wise, no deformity, no exudates, no oozing or no redness on the nose. The alignment of the nose is pretty much no deformity. No lesions or no swelling, no discharge. So is it, I'm gonna check your nose right now, okay? I'm just gonna put a light on your nose. Alright, nose are pretty much healthy. No excoriation or inflammation on both nares. No present of nasogastric, nasointestinal, or nasotracheal tube. The tongue, when I checked the tongue earlier, pretty much pink, pretty healthy. Teeth, no cavities or mucosa, is pink. And the gums, there's no sign of dehydration. And there's no discoloration or any obvious lesions for Benedict's oral health. Oral hygiene, how many times do you brush your teeth a day? Okay, do you do it like morning and night?
Mostly night.
Mostly night, okay. Awesome. And I also checked the palate, the hard and soft palate earlier. They're pretty much intact. No tooth decay, no traumas on the gum or teeth. I'm just gonna check your back, okay? Like your skin on your back and then your arms. Is that okay? Okay. I'm just gonna check your back. Sorry, my hand is a little cold. Alright, my hand is a little cold. Do you have any itching on any parts of your body?
No.
No? Okay. Alright, and is it okay if I could see your legs? Alright. Let me see the other one. Alright. So, and then can I see your hand real quick? So the turgor, it went back to its place. It only took 2 to 3 seconds to go back to a normal skin when I did the turgor. No itching on any parts of the body. I just see a mole on the back, just a tiny mole. That's it. Do you have any tenderness on any part of your body? Like any tenderness, no pain? Okay. I didn't see any petechia. No oozing on any parts of the body, no bumps, no nodules, no pain, no itchiness, and no bleeding. So I checked the body from head to toe. The skin is pretty symmetrical. The skin color, the temperature on both sides of the body are pretty much the same. I'm just gonna touch your skin, okay? And moisture. Skin is pretty much moisturized. It's not, just a little bit of dryness, but not really. Just a tiny bit of dryness and no pain when I do that. Okay. So I use the dorsum of my hand to check the temperature on any parts of the body, each side, and they're pretty much the same temperature. And I compared the upper and the lower body, and it's the same. They're both symmetrical to me. Turgor wise, the turgor, when I did the turgor, it went back to the normal within 2 to 3 seconds. No present of pressure ulcer on any parts of the body, and no lesions. He's in the clinic, no IV present. I checked the no IV present, so I'm checking right now. He's pretty much calm. He's responding to my questions. It looks like there's no any distress mood. He's no signs of any abuse or anything. Emotionally, let's see. There's no any traumas on the body. No injuries on any part of the body. So there's no signs of any abuse or anything. And when he was talking to the mom earlier, there's no any fear or any anxiety that I see to Benedict, so that's good. Mommy, do you have any family history of violence or alcoholism or drug abuse in your family?
No, I don't remember any
No
history
family
like
history
that.
of
No.
Okay. Does anyone of in your family who are unemployed have a sick right now?
No.
No. Okay. So family history is pretty much healthy. No drug abuse, no alcohol history, no violence history, and no illness in the family right now. So I see that there's no physical or emotional distress for Benedict, nothing of that, no injuries or anything. And I checked the previous observation. I checked his history of the previous observation, and I didn't find any significant difference from what I'm looking right now. From what I'm finding right now, it's pretty much the same from the last time. Do you have any physical conditions that you're concerned about or you want to discuss?
No, nothing. He's pretty much a healthy boy.
Okay, that's good. So right now, I'm just gonna check your lungs, okay? Just for a minute. Just take a deep breath for me. center lungs in right here. So I'm just gonna pull you up a little bit, okay? Just breathe normally for me. I can't hear any adventitious sounds when I auscultate the lungs. Right now I'm gonna auscultate the heart, the apical folds. On the fifth intercostal. So I listened to the heart for a minute. There's no any adventitious sound that I hear. I'm just gonna palpate the radial pulse for him. Radial pulse is strong and bounding. Let me see the other one. So I palpated both radial pulse for at least a minute, and both radial pulse are equal, strong, and bounding. Do you have any pain right now?
No.
Nothing at all? You feel good? Awesome. Okay, so I'm gonna perform hand hygiene. Alright. So right now I'm gonna document all the findings that I got. Yeah, that's it. Thank you so much, Benedict. So now I'm gonna show you my paper. Awesome. Thank you.